Hello, I'm Dr. Sindhu, one of treating doctor here today in the clinic. May I confirm your good name and age, please? Nice to meet you, Mr. Ahmed. May I know what brings you here today? Okay. Tell me more. Okay, Mr. Ahmed, is there anything else you want to add? Okay, Mr. Hamid, I'm really sorry to hear about it. I totally understand how stressful the situation is for you. But Mr. Hamid, in order to better understand your condition, I'd like to ask you a few questions. Is it okay with you? So, Mr. Hamid, can you tell me about your weight, if it is increasing? Okay. And which weather do you like the most? Summer. Okay. Okay. So what about your bowel habits? Okay. You have constipation. Okay. Any change in quality of voice recently? It has become heavier. Okay. Any hair changes? They have become thinning and dry. And any skin changes? Coarse and dry. And how about your sleep, Mr. Hamid? Okay, oversleepness and feel tired. Okay. And how about your mood? How you rate your mood most of the day? It is low. Okay, Mr. Hamid, can you tell me if you feel any morning stiffness for more than 45 years, 45 minutes in the morning in your joint? Have you noticed any black stool? If you become short of breath when you talk or when you walk? Mr. Hamid, can you tell me if your immediate family member suffering from any neck swelling or neck disease? And do you have any blood pressure? Okay. High sugars? Any heart problem? Okay. Okay, Mr. Hamid. I'll ask you a few personal questions. Is it okay with you? Mr. Hamid, can you tell me, do you smoke? How much cigarettes per day? Have you ever tried to quit smoking? Okay, that's great. I really appreciate, and we'll discuss this later in next visit. Okay, and do you drink? Okay, Mr. Hamid, what do you do for a living? Your retirement. Okay, if you're married. MashaAllah. And do you have any kids? No? Okay. Okay, Mr. Hamid, if you are taking any medicine prescribed by doctor or over the counter? If you had any past history of a neck gland? Okay, Mr. Hamid, in order to better understand your condition, I would examine you. Is it okay with you? Thank you, Mr. Hamid, for your cooperation. And then I'll sanitize my hands and let them dry, and then I'll rub them, and then I'll check for anemia and jaundice, and face for puffiness, periorbital swelling, and I'll check if the hairs are thin, skin is coarse or dry, and then I'll feel texture of skin and hair on dorsal of the hand, and I'll feel pulse and count with watch, and to look for bradycardia, and then I'll look front and side of the neck gland, and from front as patient, and I'll ask patient to take a sip of water and hold and then swallow it, and I'll ask patient to protrude his tongue, and then I'll Okay, Mr. Hamid, I'll feel your neck from behind while standing. Is it okay with you? And then I'll palpate from behind and I'll ask patient to take a sip of water. And I'll feel gland if it moves upward and look for non-bleeding edema of feet, hand and eyes lids. And then I'll check ankle jerk reflex. Thank you, Mr. Hamid, for your cooperation. And then again, I'll sanitize my hands. And okay, Mr. Hamid, have you ever undergone an investigation so far? Okay. 3 months old report. Okay. Okay. Have you been tested recently for thyroid stimulating hormone? Okay, this is the latest. Okay, Hamid, 60 years. Okay. Okay, Mr. Hamid, based on history and examination, I offer you to following test. Lipid profile and fasting blood glucose and an ECG. Okay, and your these reports are showing TSH is increased and free T4 and T3 are decreased. Okay, so actually there is a there is a gland in front of neck called thyroid, and this gland produces a chemical. In your case, this gland is producing a less amount of the chemical, because of which you are having these symptoms. Okay, but let me reassure you that we will replace these deficient chemicals with a medicine. Is it clear to you? Okay. Yes, Mr. Hamid, based on your history and examination and investigation, what I have gathered is that you are having a condition, what we call in a medical term is hypothyroidism. Okay, and yeah, this is all about the chemicals imbalance. Okay, so I'll prescribe you a tablet. Okay, levothyroxine 50 mg. It's 50 mcg. Okay, and you have to take it early in the morning. Okay, 2 tablets at the morning with empty stomach. Okay. Yeah, and if you are taking any iron supplements, no. Yeah, because if God forbid, if you visit another doctor and prescribe you iron supplements, so you should know that you should take with the gap of 4 to 6 hours. Okay, is it okay with you? Okay, Mr. Hamid, and I'll recheck your thyroid function test after 4 to 6 weeks. Okay, and then I'll adjust dose to keep your TSH in the normal range. Okay, and once your report is within normal range, then I'll monitor annually. Okay, and if you ever feel like your condition is worsening, your problem is not resolving, then you can seek immediate advice. Okay, you can contact me anytime. Okay, is everything clear till now? Shall I repeat again it for you? Okay, Mr. Hamid, I'll strongly recommend you some safety nettings and follow-up. Okay, so Mr. Hamid, will you able to take your medicine regularly? Yes. Okay. Okay, Mr. Hamid. You will probably need levothyroxine for lifetime, but please come to me after every 4 to 6 weeks to measure TSH and to adjust dose of thyroxine. Okay, will it be convenient for you? Okay, Mr. Hamid, is there anything else you wish to discuss with me today? Okay, Mr. Hamid, it is a leaflet. It includes all the information regarding hypothyroidism and the symptoms and safety nettings. I hope it will be helpful for you. Okay, and I wish you a speedy recovery. Take good care of yourself. Bye bye.